All right, welcome to another deep dive. And this time, you guys have sent us some pretty fascinating medical research
Yeah.
on hyperprolactinemia.
Hmm.
So it looks like we're going to unlock some hormonal secrets. I have to say, I'm pretty excited about this one.
Yeah, me too.
Expert speaker, one of the things that I was reading through the material and something really stood out to me is this condition is way more common than I realized.
It really is. It's funny. Most people, like you said, have never even heard of hyperprolactinemia.
Right.
But it can have, sometimes pretty significant effects on people's lives.
It's not just some rare disease, right? We're not talking about something that's affecting a tiny percentage of the population.
Exactly. And what's even more interesting is that these symptoms are often things that people experience every day, but they might not connect to a hormonal issue.
Okay, so let's break this down. First of all, what exactly is hyperprolactinemia?
Hyperprolactinemia. Well, simply put, it means you have higher than normal levels of the hormone prolactin in your blood.
Prolactin. Okay, now that's the hormone that we usually associate with breastfeeding, right?
That's right. It's essential for milk production.
Okay.
But here's where things get, I think, really fascinating.
Okay.
Prolactin plays a much broader role in the body than just lactation.
Okay.
It's involved in regulating the reproductive system, immune function,
Wow.
even bone health.
So if someone has too much prolactin, what kind of symptoms might they experience?
Well, for women, it can manifest as irregular periods, difficulty getting pregnant,
Oh, wow.
and even a lower sex drive. And you might be surprised to learn that difficulty conceiving, which is often attributed to other factors, can sometimes be traced back to elevated prolactin levels.
Okay, so I'm guessing it's not just a women's health concern.
Absolutely not.
Okay.
Men can be affected too. They might experience erectile dysfunction, low testosterone, and just like women, low libido. And unfortunately, because we often view it as a female hormone, hyperprolactinemia in men can go undiagnosed for quite a while.
That makes sense. Now, the source material mentioned that the severity of symptoms seems to depend on just how high those prolactin levels are.
Yeah,
Can you walk us through that?
sure. So imagine like a volume knob
Okay.
that's controlling your prolactin levels.
Yeah.
A slight turn might cause subtle changes, while cranking it up can lead to more noticeable symptoms.
Okay.
So someone with extremely high prolactin levels, let's say over 200 nanograms per milliliter,
Okay.
is highly likely to have a prolactinoma.
Prolactinome, isn't that a tumor in the pituitary gland?
Yes, that's right. It's a benign tumor that produces prolactin.
Okay.
But on the other end of the spectrum, someone with just slightly elevated prolactin might only notice subtle changes in their menstrual cycle, maybe some breast tenderness, or even no noticeable symptoms at all.
Right.
It all comes down to the degree of elevation.
Speaking of high prolactin levels, there's this thing called the hook effect that I found fascinating and a little bit alarming.
Yep.
Apparently, really, really high prolactin levels can sometimes cause a falsely low reading on a blood test. How is that even possible?
It's a bit of a quirk, I guess, in the lab testing process. So
Right.
imagine a patient with a prolactinoma so large
Mm-hmm.
that it produces massive amounts of prolactin, right?
Right.
Their initial blood test might show normal levels,
Wow.
leading to a misdiagnosis.
That's kind of scary to think about. So if you were a doctor, and let's say a 30-year-old woman came into your office
Yeah.
complaining of irregular periods and having trouble getting pregnant,
Right.
what would be your first thought?
Well, given her symptoms, hyperprolactinemia would definitely be on my radar. The first step would be to order a blood test
Oh.
to check her prolactin levels.
Got it.
And if those came back high, then we need to figure out what's causing it.
Now, the source material mentioned medications as a potential culprit.
Right.
Are there certain drugs that are known to mess with prolactin?
Oh, absolutely. A variety of common medications
Huh.
can lead to elevated prolactin levels.
Such as?
This includes some antidepressants, antipsychotics, even certain medications for high blood pressure and heartburn.
Wow.
So getting a detailed medication history from the patient is really important in these cases.
So let's say this woman's prolactin levels are high
Yeah,
and she's not taking any medications that could be causing it.
right.
What would you do next?
So we'd want to rule out other potential causes like hypothyroidism and kidney disease,
Okay.
both of which can lead to elevated prolactin. An MRI of the brain would also be a common next step to get a clear picture of the pituitary gland and check for a prolactinoma.
That makes sense. And here's something that really caught my eye in the research is not all cases of hyperprolactinemia
Right.
are due to tumors.
That's a common misconception.
Mm.
While prolactinomas are a frequent cause, especially when prolactin levels are very high, they're not the only game in town. As we mentioned, certain medications can lead to it, as well as hypothyroidism, kidney disease, and even some chest wall injuries or excessive stimulation of the nipples.
Okay, now I have to circle back to something we touched on earlier, galactorrhea. The source material mentioned that you can have milk production without high prolactin levels.
Interesting.
That seems a bit counterintuitive.
It is interesting, isn't it?
Yeah.
It's important to remember that prolactin isn't the only factor involved in lactation. Sometimes women experience residual milk production, even after pregnancy, or a period of elevated prolactin due to medications.
So it's usually not a sign of anything serious?
In most cases, no. But it's always a good idea to get checked out by a doctor to rule out any underlying issues.
That's reassuring.
Yeah.
So we've covered a lot of ground here, the various symptoms of hyperprolactinemia, the different causes, and we even touched on the diagnosis.
Right.
But what about treatment? What can be done for someone who is diagnosed with hyperprolactinemia?
Well, the good news is that there are effective treatment options available.
Okay.
And the best approach really depends on the underlying cause.
Okay.
For example, if medication is the culprit, sometimes simply adjusting the dosage or switching to a different drug can do the trick.
And what about in cases where a prolactinoma is the cause?
In many instances, medication can be very effective in shrinking the tumor and managing symptoms.
Now, what kind of medication are we talking about here?
The go-to drugs for hyperprolactinemia are called dopamine agonists. And think of dopamine agonists as master impersonators, mimicking dopamine's actions to curb prolactin production.
Dopamine. Okay, so that's a brain chemical, right?
Yes, it's a neurotransmitter that naturally inhibits prolactin release. So by boosting dopamine's activity, these medications help put the brakes on prolactin production.
That makes sense. Now, the source material didn't go into a lot of detail about the different types of dopamine agonists or how they work. It feels like there's a whole other layer to this that we haven't even touched on yet.
There definitely is.
Yeah.
What's fascinating here is that the mechanism of action of dopamine agonists is actually quite complex and involves a delicate interplay between different dopamine receptor subtypes in the pituitary gland. These medications preferentially bind to specific subtypes of dopamine receptors, triggering a cascade of intracellular events that ultimately lead to a decrease in prolactin synthesis and release.
Hold on, that sounds pretty complicated. You're talking about receptors and subtypes and cascades.
I know, it can get a little technical, but I think it's important to understand the basics of how these medications work.
You know what, you're right. This deep dive was supposed to be all about getting into the nitty-gritty details. So let's unpack this a bit more. What are these dopamine receptor subtypes, and how do they relate to the different types of dopamine agonists?
Well, there are actually several subtypes of dopamine receptors, and they're not all created equal when it comes to regulating prolactin. Some dopamine agonists primarily target the D2 receptor subtype, while others have a higher affinity for the D1 or D3 subtypes. These differences in receptor selectivity can influence both the efficacy and side effect profile of each medication.
This is getting really interesting. It seems like there's a whole world of dopamine receptor science to explore.
There absolutely is.
So should we take a deep dive into the dopamine rabbit hole?
Let's do it.
All right, listeners, get ready for part 2 of our hyperprolactinemia deep dive.
Yes.
Where we'll explore the dopamine agonist landscape. Stay tuned.
I'm excited.
Me too.
Okay, so we're stepping into the world of dopamine agonists now.
Oh, right.
The go-to medications for treating hyperprolactinemia.
I am ready to dive in. I'm already fascinated by these medications and how they work. It's like a secret agent mission at the cellular level.
I like that analogy.
Right.
So remember how we talked about dopamine receptors?
Yes.
These are like tiny doorways on the surface of cells in the pituitary gland.
Right, and dopamine is the key that unlocks those doors.
Exactly. And when dopamine binds to those receptors, it sends a signal that says, hey, pituitary gland, slow down the prolactin production.
Okay, so dopamine agonists are like master keys mimicking dopamine to trick those receptors into reducing prolactin levels?
Precisely. And here's where it gets really interesting. There are actually different types of dopamine agonists. Each with its own unique way of interacting with those receptors.
Okay, now we're getting into the nitty-gritty. Tell me more about these different types.
So some dopamine agonists like bromocriptine and cabergoline primarily target the D2 receptor subtype. Think of them as specialists, highly skilled at unlocking that particular door.
So they're like expert lock pickers for the D2 receptor.
Exactly. Now, other dopamine agonists, such as pergolide and ropinirole, have a broader reach,
Oh,
binding to both D2 and D1 receptors.
right.
They're more like generalists, capable of interacting with multiple receptor subtypes.
So we've got our specialists and our generalists.
Right.
What about their effectiveness? Are some better than others?
That's a great question. Cabergoline, one of the D2 specialists, is often considered the most potent dopamine agonist for treating hyperprolactinemia.
Okay.
It's incredibly effective at lowering prolactin levels and shrinking prolactinomas.
So it's like the top tier agent in the dopamine agonist world.
You could say that. It's often the preferred choice for many patients, but it's not without its potential downsides.
Downsides. What kind of side effects are we talking about?
Like any medication, dopamine agonists can cause side effects. Some common ones include nausea, dizziness, headaches, and fatigue.
Are these side effects usually severe?
For most people, they tend to be mild
Okay.
and often improve over time as the body adjusts to the medication.
Okay.
However, there are some rare but more serious side effects that we need to be aware of.
Okay, this is where it gets a little bit concerning.
Right.
What are these serious side effects?
Well, one potential concern with certain dopamine agonists,
All right.
particularly cabergoline, is the risk of heart valve problems.
Heart valve problems. That
Yeah.
sounds serious.
It is. That's why regular monitoring is essential for patients taking these medications,
Okay.
especially if they're on higher doses or have pre-existing heart conditions.
So it's a matter of weighing the benefits against the potential risks.
Exactly. Each patient's situation is unique, and the best treatment approach needs to be carefully considered and individualized.
Now, I remember you mentioned that dopamine agonists are usually the first line of treatment for hyperprolactinemia.
Right.
But what happens if medication doesn't work or isn't a suitable option for a patient?
In those cases, surgery might be considered.
Surgery to remove the pituitary tumor.
Yes, that's typically what it involves. However, surgery is generally reserved for situations where medications haven't been effective or the tumor is causing other problems like vision changes
Okay.
due to pressure on the optic nerve.
So it's a last resort.
You could say that
Okay.
surgery always carries risks, and it's not always a guaranteed fix.
This deep dive has really opened my eyes to the complexities of hyperprolactinemia. It's not just a simple hormonal imbalance. It's a multifaceted condition with a range of potential causes and treatment options.
It's a great example of how interconnected our bodies are
Right.
and how seemingly small imbalances can have significant repercussions.
And it highlights the importance of personalized medicine, tailoring the treatment approach to each individual's needs and circumstances.
Absolutely. There's no one-size-fits-all solution when it comes to hyperprolactinemia.
You know, as we've been talking about dopamine agonists and their effects on the body, I can't help but wonder about the broader implications of manipulating dopamine levels. Dopamine is involved in so many brain functions, not just prolactin regulation. Could there be unintended consequences of altering its activity?
That's a fascinating question, and one that researchers are actively exploring.
Like, what are some of the potential unintended consequences?
Well, dopamine is a key player in our reward and pleasure pathways.
So it's the brain chemical that makes us feel good.
Exactly. It's involved in motivation, focus, even addiction.
So if we're messing with dopamine levels, could that have an impact on those things?
It's definitely possible. There's some evidence to suggest that dopamine agonists can, in some cases, trigger impulse control disorders, like gambling addiction or compulsive shopping.
Wow, that's kind of unsettling.
It is something to be mindful of. Again, these side effects are rare,
Right.
but they underscore the importance of careful monitoring and open communication between patients and their doctors.
So the dopamine agonist story is a bit more nuanced than I initially thought.
It definitely is.
Yeah.
These medications can be incredibly effective at managing hyperprolactinemia and improving people's lives,
Right.
but they're not without their potential downsides.
It seems like every time we peel back a layer of this hyperprolactinemia onion, we find another layer underneath.
That's the beauty of science, isn't it?
Yeah.
There's always more to discover and understand.
Well, listeners, we've delved deep into the dopamine agonist landscape, exploring the different types, their mechanisms of action, and even some potential risks. But our hyperprolactinemia journey isn't over yet. There's still so much to uncover.
And remember, knowledge is power. The more we understand about our bodies and the medications we take, the better equipped we are to advocate for our health.
Stay tuned for the final part of our hyperprolactinemia deep dive, where we'll explore the long-term consequences of this condition and what happens when it's left untreated. All right, Welcome back to our hyperprolactinemia deep dive. We've covered a lot of ground already, from the signs of this condition to the dopamine agonists,
Mm.
but there's one more crucial aspect we need to explore, and that is the long-term consequences of hyperprolactinemia if it goes untreated.
Right, that's a really important point. I think we often focus on the immediate symptoms, but the long-term effects can be just as significant, if not more so.
The source material mentioned bone health, which we touched on briefly earlier. Can you elaborate on that a little bit?
Sure, so you see, when prolactin levels are chronically elevated, it can actually interfere with bone metabolism,
Okay.
potentially leading to a decrease in bone density over time.
That's concerning. Osteoporosis and bone fractures are already major health concerns, especially as we age.
Exactly. And it really underscores why getting a proper diagnosis and effectively managing hyperprolactinemia is so important.
Right.
It's not just about addressing those immediate symptoms, but also potentially preventing long-term complications down the road.
The research didn't delve too deeply into this, but I'm curious about the potential impact of untreated hyperprolactinemia on other aspects of health. Could there be long-term consequences for things like cardiovascular health or even cognitive function?
That's a really insightful question. And while the research on those specific links is still kind of emerging, there are some intriguing findings that suggest we need to investigate this further.
Okay, tell me more. What are some of the potential connections researchers are exploring?
So some studies have suggested that elevated prolactin levels might be associated with an increased risk of cardiovascular issues,
Okay.
such as high blood pressure and heart disease.
So it's not just a hormone that's affecting reproductive health. It could have broader implications for our overall well-being.
Precisely. And there's also emerging evidence hinting at a possible role for prolactin in neuroinflammation and cognitive decline.
Really?
More research is definitely needed in these areas,
Mm.
but it's definitely something to keep an eye on.
It's incredible how much we're still learning about prolactin and its far-reaching effects.
It really is. It speaks to the interconnectedness of our bodies.
Yeah.
Hormones are like messengers,
Right.
orchestrating this complex symphony of processes throughout our systems.
And when those hormonal harmonies are disrupted, it can create a ripple effect with consequences we might not even fully understand yet.
That's a great way to put it.
Throughout this deep dive, we've talked about the symptoms, causes, and treatments for hyperprolactinemia, but something that has really struck me is the emotional impact
Yeah.
this condition can have. Dealing with infertility, low libido, or even just the fear of a pituitary tumor can take a real toll on a person's mental and emotional well-being.
Absolutely. I think it's so important to acknowledge that aspect of this condition. The emotional burden can be very significant,
Right.
and seeking support from loved ones, therapists, or support groups can be incredibly helpful during that time.
That's such a valuable reminder. Sometimes we get so focused on the physical aspects of health that we forget about the emotional and psychological dimensions.
And those dimensions are just as important, I think. Our mental and emotional well-being play a huge role in our overall health and resilience.
Well, listeners, I think we've squeezed every last drop of insight out of this deep dive into hyperprolactinemia. We've uncovered the common, the uncommon, and even the seemingly paradoxical aspects of this surprisingly prevalent condition.
Yeah, it's been a really interesting journey.
And we've explored the importance of early diagnosis, effective management, and the potential long-term implications of this hormonal imbalance. Remember, knowledge is power. The more we understand about our bodies, the better equipped we are to advocate for ourselves and make informed decisions about our health. As always, we'd love to hear your thoughts and reflections on this deep dive. Leave us a comment, send us a message, or connect with us on social media. Until next time, stay curious, keep learning, and never underestimate the power of a well-regulated hormone.